Everybody. Welcome to our April University Libraries Colloquium event. I see some of you that are here this time were here last time, so thanks for coming back. And a few new faces as well, so welcome to y'all for coming to your first colloquium event. As this is a new thing, we're always looking for ways to improve. So we do have a survey and we welcome any feedback because we want this to be a long-running, long-standing event series, and we want to gradually make it better and better. So those of you who are here in person, there's a QR code on the snack table that'll link you to the survey. There'll be a survey placed in chat for those of the people who are attending virtually. And like I said, we welcome any and all feedback. I don't have a big spiel prepared today. I'm just going to jump right into it and go ahead and introduce this month's speaker, who is our very own health sciences librarian, Dr. Irma Cingarella. And she's going to talk to us today about the role of health information professionals, reflections during the COVID-19 pandemic. So let's welcome Dr. Cingarella.
Morning.
Good morning.
So glad to be here, and good morning to the virtual audience too. First, I just want to start by acknowledging my island of Puerto Rico. I come from the Caribbean. This is a picture someone took at my hometown. And this is where I come from. Puerto Rico is in Spanish for rich port. Some people abbreviate it as PR. And the Taínos, natives, called it Boriquen. And Puerto Rico is a territory of the United States. Let me go back before I finish. We have different islands. Puerto Rico is a group of islands, including Mona, monkey or female, Monito, little monkey, Desecheo, Vieques, or Vieque, like the natives used to call it. So I would like to acknowledge all the natives who live in Puerto Rico, Boriquen, before the conquistadors arrived. And I have a disclaimer here. Everything I say is through my lenses as a health sciences librarian, a female, a mother, a Latina woman from the Caribbean, and my experience as a health sciences librarian for more than 20 years. And my purpose today is to, in the first place, share my research with you. Almost 5 years ago, I received a special request to develop a presentation about the roles of the health sciences librarian and the trends of the health sciences librarian. And it was a very important moment in my career. Through these years, I've been updating my research, finding different roles, different activities, collaboration between health information professionals and other librarians, as well as library staff. But something happened, and it was COVID-19. When I was updating my research, I noticed that our roles expanded. Well, everything changed for everybody. And because we are information experts, and we believe that information access is a human right, everything we do is about service, is about the public. Everything is centered on using focus on user demands, trends. And we have a picture here of Eleanor Roosevelt. She's holding a copy of the Universal Declaration of Human Rights adopted by the United Nations in December 1948. So some people say it's symbolic. It's not. Well, some countries have developed legislation based on this document, but for us, it is a goal. It is a goal. And I would like to share stories. Another disclaimer, there is a lot of information available about these topics. So once again, it's an invitation to look for these stories. This picture is in Rio Condor, Tierra del Fuego, fire, earth. This is an island that is have from Chile and Argentina. And in 1998, the government in Chile refused to release information about a major US project to a local organization. Several human rights groups filed a petition with the Inter-American Commission on Human Rights, claiming that withholding information violates human rights. The commission urged Chile to bring its domestic laws into conformity with the human rights document, and when the government refused, they were forced to do it by a court. The court agreed that with the in March 2005, the Inter-American Commission found that Chile had violated the plaintiff's rights under the article of the American Convention on Human Rights, which states that everyone has the right to freedom to seek, receive, and impart information and ideas of all kinds of freedom. So the requested information was about the Rio Condor project, an extensive timber logging operation by US company Forestal Trillium on the island of Tierra del Fuego. So once again, countries are moving in that direction. Information is a basic human right. And there is evidence in the literature, number one, that information services have gone through remarkable changes through history. And we don't have to go deeply in the literature. We know that because that's what we do every day. And we see that libraries are a vital resource for academics, the community, and healthcare. Diverse information, we provide diverse information to diverse communities. And our roles have been changing. Not only librarians, the diverse group of staff members, they share that responsibility, and everything is changing. So I'm just going to talk about the methodology. One of the strategies that I used was to use health sciences librarians and roles, both used as keywords in title and abstract. And I reviewed diverse academic databases, including CNO, PubMed, Scopus is not there, but I used it too. And those are the dates that I use. I tried peer-reviewed articles first, and then I added other content. I added other content because they were describing new roles, new trends. So this presentation is going to be available. I have a lot of references here that are available, and the full text too. But I want to present the 7 different but overlapping categories that I found: arts, collaboration, COVID, education, services, activism, and technology. This emerged from the literature. So you see the circles, because education deals with technologies and services with education. So that's why we say that those are overlapping circles. So the first one, arts. Arts have been an essential part of the history of libraries in many ways. In collection content, programs, services, we have branch libraries, like music libraries, art content. So something very important that I want to present today is that multitude of studies, there's evidence that participation in art is related with both physical and mental health. So we should always defend our arts curriculum, our arts libraries, collections, and activities. I really like the National Library of Medicine exhibition program. It is part of the regular offer, and libraries receive different exhibitions as part of the National Library of Medicine Services. Collaborations. No matter where I look, librarians, library staff, everything is about collaboration with students, with faculty, with other staff members. And this represents a very interesting project between physical therapy program and the library. The students, develop devices using the 3D printer. And you can see some examples here. International programs. We participate in different international programs, health information literacy, open access movements. There's a lot of information available about librarians, health sciences librarian, health information professionals participating in global health and international programs. Writing centers work with librarians. We have an excellent example here. Book clubs, we develop book clubs and even publish peer-reviewed journals. So librarians and library technicians, in the literature, library technicians and library staff are used as synonyms. So we develop projects in several ways, and those expanding services should consider always library staff when developing different projects. And then health-related services. The field of librarianship has a history of involvement with patient education, general literacy, information literacy effort. There is a special program that is about navigating the system. We know that the healthcare system is not easy. Even as a health sciences librarian, I have encountered several challenges. So there are different programs to help patients. And systematic reviews. Systematic reviews are very important for health sciences librarian. Those are synthesis of the literature, and there are different types of systematic reviews, and that would be a topic for another presentation. And we found information in different disciplines: veterinary, health sciences, medicine, nursing, public health. The next category is education, and that is a beautiful picture. I said I'm very biased. This is one of the most beautiful libraries, the Health Sciences Library of the University of Memphis. And that picture was taken by John Swearingen. Education, it's all over the place. We have many roles: research specialists, e-resources librarians. They create the content, they manage the content so we can educate, so we see those overlapping circles once again. Medical sciences programs, and those responsibilities are increasing, changing, enhancing. Collaboration with the faculty. We still have our one-shot training, and we also have the integration that keeps appearing in the literature. And health literacy. We all need to develop health literacy skills, and that is the degree to which individuals have the capacity to obtain, process, and understand basic information, basic health information. And now organizations have the responsibility to provide education, health literacy standards for the staff. And health literacy has three main components. It's the capacity to obtain information, understand information, apply, and act. Health literacy is about action. And we all know this concept of evidence-based practice. Most pediatric residency programs, as well as other programs, just accept evidence-based, and that means that we have the best document, the best literature available. And once again, that's another action concept. It is critical to have the best evidence. And services. Communication, evaluation, information retrieval, and these are just examples of categories, subcategories that I found under services, special projects, technology. And this is, once again, a picture of the Baptist Memorial Healthcare Library of the University of Memphis. And social activism. I found different cases of librarians being very active for different causes. And it says that you know it's bad when librarians are marching. So Martin, one of the researchers in 2020, said that we live in a multicultural environment. We need to be active, and we have been active, engaged in crucial conversations and debate. We have noticed that there's a lot of research about libraries, the fact that libraries should be available for everyone in a multicultural environment. So we need to develop, and we are developing projects, research guides, and other content in different languages. Some languages are not even included as part of the internet content. They don't exist. Some languages are disappearing all over the world, and they do not exist when we search the internet. So we have a history of activism, social activism, and different efforts to include, to be diverse, and to promote equity and inclusion in our activities. And I think this library is an excellent example with all the exhibits and the collection development about these topics. And technology, of course, covers everything else. The computer-related technologies change our world. Some of us studied library sciences a long time ago, and the curriculum now is very different because technology changed everything and keeps changing. So we have medical informatics, bioinformatics, computational biology, and work services, and the world of health sciences changed with the medical health record system. So the development of the computer and related technologies is being recognized as an increasingly important role for librarians and for everybody else. So the role of the medical librarian in the future is whatever we have the ability to do well, and the future is, to this extent, ours to see. This was published in 1957. But then we had to learn how to offer services even when we didn't feel like we had the ability to do things well. And it was when COVID happened. And with COVID, we had a tsunami of information, misinformation, rumors, fake news. And we know that in the Middle Ages, the same thing happened. And through history, we know that things happen in waves, they repeat or in different ways. I just have some examples here of literature. The health crisis have been registered as part of history and literature. And some of us might want to read all these excellent books. These are classics. La Peste from Camus, he's a French author. El Amor en Tiempos del Cólera is about cholera outbreaks. And of course, the bubonic era. So these are registries of diverse health crises. It is evident that all this brought emotional reactions. La Peste, the bacteria was called Yersinia, and Loving Time of Cholera by Gabriel Garcia Marquez brings the detail of a health professional who used to work healing patients, treating patients of cholera, and the bubonic plague in 1556 and other outbreaks in 1678. So we try to understand the present, or at least we have our own interpretations of the present by looking at the past. And if we review these plagues and the plague that erupted in Athens, for example, irrationality always erupts as humans. This is a human reaction. And even in glorious eras with Plato and other philosophers, we find the same situations. And going back to the librarian's roles, we see that we keep mixing traditional, or what are called traditional services, lending books, but we also increase awareness of all these situations and health crises. Online learning is part of our world now. We needed to develop skills quickly. Some of us needed to help support faculty members who had to run and prepare their courses to be online, and professional development, intense professional development to keep working with all new with all these new technologies to communicate, to research consultations, to keep serving our public, chat services, support health professionals who need information instantly. And we compile resources of curated content to avoid that epidemic of misinformation. So online learning, remote work, communication through different platforms like Zoom, email, Google Hangouts, and many others also provided space for webinars and different online workshops. And what happened? With all this technology, which is great, the digital divide was terrible. It grew, it intensified the fact that some people have access to technology and resources and others do not. So collaborative efforts among diverse librarians and other health information professionals helped during the pandemic, and we are still working on it. So we developed new virtual service. We improved internal communication. We kept in contact. Technology dramatically impacted the extent and the availability of digital information. So we are learning new words. I am learning new words that are not that new, but I'm still learning. Infodemic, misinformation, disinformation, and many others. And we'll talk about that, but first, let's discuss the rapid growth of COVID-related literature. Librarians and libraries are called myth busters in the literature, fact checkers. We have developed different tools to evaluate information. And the National Communications Association shows here a wave of information and misinformation that is gonna wash this person over. So infodemic, and infodemic is too much information. It doesn't matter if it's quality information. When it's too much, it's too much. So that can be in digital and physical environments during a disease outbreak, and it leads to mistrust authorities, undermines public health response. People assume risk-taking behaviors that can harm their health, their life, the life of their family. And people are unsure on how to protect. The organization Cochrane developed a library immediately of their systematic reviews. But something that also happens is that it causes short attention span. And another pandemic that we'll suffer is the pandemic of our emotions, our psychological stability. And this is a phenomenon in research. It's called, I told you I'm learning new words, COVIDization of research. And according to Scopus, until August 1st, 2021, there were more than 200 COVID-19 related papers. That's almost 5% of the general literature published. The most common countries of this were USA in the first place, publishing China, United Kingdom, Italy, India, Spain, and then things changed and China had more authors involved in COVID-related papers. So there have been China and the United States. There were spread of publications from diverse disciplines, including librarians. We have published on the topic. So not only health sciences, not only health professionals. COVID impacted everybody, impacted every organization. So there's a lot of information. And the growth of this literature was far more rapid and massive compared with H1N1, Zika, Ebola, HIV, and even tuberculosis. Misinformation, once again, it's false information that is spread. It doesn't matter the intention. And the public was bombarded with vast quantities of information, much of which is not correct. And it has been accompanied by an explosion of content. So here, once again, this is another reference about the explosion of inaccurate information that makes it difficult to understand and make informed decisions, and fake information. And we cannot trust our brain. Sometimes there's a lot of literature on how we process information and how when we keep reading the same content, it gets to the point that we ask ourselves, is this true? And also, it is hard for people, for us to understand when we are wrong. So it's better to accept what we want to believe. So we have those biases, confirmation biases. So there's a book, a research published by the University of Australia that I would recommend. And it's an open access book, The Psychology of Fake News, that they analyze the psychological factors that lead us to believe and share misinformation. And then disinformation is deliberate, is with the D, deliberate dissemination and to discredit. So that help us to remember the concept. And some things are just obvious. We don't believe everything we see. Some people do, some do not. So some things are almost funny, but fake news campaigns are not new. There's research that even emperors in Rome used coins to spread fake news about their opponents. And this is a small picture, but it is about the description of the moon. And when I have a fact here that in 2017, fake news became Collins Dictionary word of the year, and it's remained in the headlines ever since. So we think that these words are modern, but in ancient Rome until the present day, stories that are not true are meant to be misleading, have been used to make money, change people's views and opinions, and make us question who we trust, who we can trust. So now it's even worse with the explosion of the internet and social media. It seems to be everywhere, and it travels faster than the virus. After the invention of the printing press in the 15th century, the same thing happened. So we have misinformation, disinformation, and even malinformation that is so disturbing that we don't want to talk about it because it's shocking, but we need to discuss it. So what are we going to do? We have different tools. We have librarians. We have information professionals. But Mantas compiled a 6-step kit. And the first thing what we need to do with all this information is to stop and breathe. Check the source. And please trust scientists before politicians. Beware of your emotions and our biases. Use the tools. Contact your librarians, your experts, your technology expert to review and verify images and videos, and accept that sometimes we don't know. Know that we don't know. Okay, so who can identify this bridge first? Hey, Brooklyn Bridge, yes. So when the Brooklyn Bridge opened, everybody was scared, but now it's a symbol of worlds crossing and collaborations. And good news, libraries have been successful fighting misinformation. I found evidence, research of collaboration, public libraries working with librarians from different disciplines. So my conclusion that this is a transformational time. Before COVID, this was for health sciences librarians, and I think this is a transformational time for everybody. We have assumed diverse, proactive, resilient, and essential roles. And of course, we have challenges, and this is changing. Everything is changing. Scholarly communication, research. You saw all that research. Sometimes we don't have time to develop access points. We have preprints. Sometimes the peer review process is non-existent. So scientific rigor versus a timely fashion have to meet the standards of the user. So we redefine our roles, and we keep redefining our roles while we deal with our own emotions and realities, and we discover new ways to be involved, not only in access, but in every stage of research, the research process. Something that I've seen recently is that finally librarians are being included as authors of literature reviews, systematic reviews, and my representations does not include all the librarian roles. So this is the information about the Baptist Memorial Healthcare Library. Please visit us. This is a sample of the references that I used. And I have two pictures here. Who recognizes this bridge? Yes. Memphis is the 5th most populous city in the Southeast. Is the nation's 28th largest city and the largest city proper of those situated along the Mississippi River. It's one of the more historic and culturally significant cities in the United States. Memphis has a wide variety of landscapes, and I am very glad to be here and honored to present. So thank you, and we have time for discussion and questions.
I have one.
Yeah.
Since COVID, have you seen a decline of students utilizing the help library?
Oh, yes. It's a different world, and it's a different energy. They're coming back, but it's been a process, and we all talk about a new reality, and even when it sounds like almost a cliche, it is a new reality. It's like before and after. Yes, that's a great question. Have you experienced the same thing here? Yes, yes. And we keep developing these various strategies to make science accessible and use and easy vocabulary to attract users, to attract the community, and we go to the community when they don't come here. So those traditional roles are mixing with new ones, right? So it's the outreach approach. And once again, collaboration. I have a quote here about the commitment among researchers, healthcare professionals, information professionals, IT experts, social media, students. Everybody's working on the collaboration. This is a teamwork. Anybody else? Questions, comments? Drink some water.
Dr. Cinderella, we have a question
Yes.
from online. Someone
Sure.
says, has there been research on the impact of COVID?
There's a lot of research on the impact of COVID in different areas, social life, communication, the use of libraries. Yes, yes. And I would like to add that I would be happy to receive emails. I can send these references and information, more content on these topics. I know this is an overview. The situation is complex and complicated, but yes, the impact of COVID in life. And when we talk about the digital gap in education, access to services. For example, telehealth help a lot of patients, but some people don't have access to internet, but don't have the technology, transportation, and the services. Mothers, parents in general have their kids home, so they couldn't access services. So COVID have impacted every aspect of our life. And yes, there is a lot of research on the content.
So you mentioned about the access to technology. You see research about such a door of learners that are trying to go to Web 2.0 tools, their lack of knowledge of technology, but having access to one thing, but their actual skill set.
Yes, I'm so glad you mentioned that. because that's part of the gap. It's not only the fact that you can access, you can go to a library, but you need to develop the skills, and you don't do that in an hour. Yes, that is not only research. I've seen projects, which is good, going to the community and helping people to develop not only the skills, but also the mindset that we need to keep learning, and we all need to keep learning. And I think we still have to work on that topic and develop more research. Yes, great point. Anything else? Well, thank you. Gracias.